Why do so many guys get so insecure about hair loss in the first place?
So previously we were seeing balding in 30s, 40s or 50s maybe. Nowadays we bald at 19, 20 also. So this is because of I have incidences where mom is also balding.
Oh really? Even women bald?
Yeah, why not?
Why do they bald? Can I do a hair transplant and actually grow out a beard?
Yes. I've had a lot of beard transplants.
What?
Beard, eyebrows.
Eyebrows?
Yeah.
Why eyebrows? The most expensive that this procedure can go to is about 10 lakhs.
There are doctors charging 50 lakhs also, and there are clinics doing 50,000 also. Also at the same time there are so many EMI options
There's EMI options.
for hair transplant.
Really?
Yeah.
Hair loan.
And so many banks at 0% interest.
Can the transplanted follicles grow into long hair
Yes.
fully?
You can cut it, shave it, color it, style it the way you want it.
They say that hard water can damage hair quality.
Can be used.
So when people go to an unqualified person, what can go wrong?
This is what has been going wrong in a lot of patients who travel to Turkey.
What is this Turkey angle?
Turkey is been very popular if everyone knows for hair transplants. But the major procedure what is required is not done nicely.
What do you have to correct?
Consider some hair growing this side, some growing there. There are a lot of gaps and looks very bad. It looks ugly in fact. So we have to correct. Now the donor is already damaged.
People can get fooled a lot. Let's talk about some of those so-called scams.
There are a lot of marketing gimmicks. They tell you to use a product for a year or two and get your hair back.
What percentage of people should actually be going for hair transplants? This was very enlightening from multiple perspectives, and I'm sure this podcast is going to help lots of people out there. First and foremost, if you're facing male pattern baldness, if you're facing a lot of hair fall and you want to maintain your hairline, you want to take care of your hair, let me tell you that this is a very normal, very common problem. And secondly, because of the science available today, this is a very solvable problem. So relax before you begin consuming this particular episode. Dr. Abhishek Pilani is one of the most renowned hair transplant experts in our country today. There's hair transplant clinics all over the world today, especially Turkey for some reason. But India is coming up as a hair transplant capital of the world along with Turkey because of doctors like Dr. Abhishek Pilani. If you're getting a treatment done like this, first and foremost, ensure you're going to the experts of the field. Ideally, you should get treated by an MBBS and MD qualified doctor. And thirdly, you should educate yourself about this subject and this kind of treatment before you go in for a hair transplant. That's what I've tried bringing you through today's podcast. Enjoy the special of Dr. Abhishek Pilani of Ashok Clinics on TRS. Just two well-dressed guys talking about men's problems once again today. Dr. Pilani, you're a beautiful man. You kind of look like Ranveer Singh.
Thank you so much.
How are you, good sir?
Perfectly fine. It's my pleasure and thank you for having me here.
I love what you're wearing. I love what I'm wearing. It almost feels like we're going to be doing an arms deal or something today.
I guess whatever conversation happens, that will be equivalent to that.
It'll be explosive, the conversation, because this is one of the most explosive men's problems related to hair loss. As you grow up as a guy, you deal with pimples, you deal with hair loss, you deal with like weight related problems, and you grow up with a lot of insecurities. My personal belief is that you should earn enough money to be able to fix those insecurities through the technologies and biological solutions that are available. Fair to say that?
100%.
Everything is fixable,
Everything is now fixable.
right? Let's begin this topic by addressing insecurities because you meet all sorts of bros who come up to you for hair transplant specifically. Why do so many guys get so insecure about hair loss in the first place? Let's talk about that.
So before talking about hair loss, let me take a step back and explain you what is hair loss, what is hair thinning, and what is hair fall. Because there's a lot of misconceptions regarding the terminologies. Every second person says, I'm having this. So hair fall, if I have to say, it is a normal cycle where hair goes in a shedding phase and grows back. That's with every individual. Hair thinning is where there is hair miniaturization, where you start losing volume, thickness, and density. And hair loss is actual thick terminal follicles go in a villous stage which is not visible to naked eye.
As in?
So it goes in a complete stage of baldness. So that is the actual hair loss.
You mean like the structure of a hair?
Yeah, so it's a thick follicle. So basically entire human body, you see somewhere there is fine hair, somewhere there's thick hair on your scalp. You can see small hair follicles on your forehead and something. So these are known as villous hair in medical terminology.
Villous hair,
Yeah.
when it's thick.
When it's thinned out, which is not visible to naked eye.
Okay.
So that is the phase of thinning and baldness which happens. A thick follicle goes to a finer follicle, and goes to a stage which is not visible. So that is where the baldness sets in.
What is the root of the hair shaft called?
So root of the hair shaft, it's an entire unit. It's a follicle unit with multiple parts: the bulb, the stem, the proliferative cells, and everything.
Okay. For the sake of better understanding,
Yeah.
can we compare it to a tree?
We can, in some sense.
So there is like the main body of the tree, which is what we see on the outside.
Right.
And you're saying that when someone is balding, that body of the tree becomes thinner.
It starts thinning out completely.
And in the highest stage of hair loss, the root of the tree only dies.
It doesn't die, but it is to a phase where it doesn't give you a thick follicle finally.
Like it becomes weakened itself.
Yeah, completely, almost dead.
Almost dead.
Yeah.
And that's the highest form of hair loss where you see
and then that is when you see a complete bald person at different grades
with a shiny head.
with a shiny head.
So effectively what's happened in the scalp is the roots have become very weak.
So basically, there's a hormonal theory behind that the major concern about anything, it is your male hormones, androgen, which gets converted to testosterone, a more potent form, and a more potent dihydrotestosterone, which gets attached to the follicles, causes thinning and the damage.
One second, we got to slow it down a little bit. Okay?
Sure.
So every male body contains testosterone
Androgen,
in our
yeah.
balls. So pre it becoming testosterone, the precursor to testosterone is something called androgens.
Androgen.
Now, how is this precursor related to balding?
So basically, testosterone is a very important hormone related to our body, related to many other functions, and this gets converted to a more potent form, that is dihydrotestosterone.
Why?
That's a reaction because of multiple factors happening in the body, and that dihydrotestosterone is the major reason which attaches the follicle and causes the thinning and hair miniaturization.
So guys who are actually dealing with hair thinning or hair loss have a higher level of testosterone?
Testosterone level may be same, there will be more conversion of dihydrotestosterone.
Okay.
And there can be free testosterone excessive levels also, depends.
Fair to say this is primarily based on genetic factors?
Majorly.
Yeah. I read this theory when we were growing up in terms of, I think, dominant genetic factors versus non-dominant.
Right.
So if one of the two parents is tall, the kid will be tall.
Yeah.
Similarly, if one of the two parents carries a bald gene, so the mom...
So one of the parents or the family members also.
So say if your mom is obviously not bald, but her brother might be bald or her dad, your nana might be bald.
So maternal, paternal, either of the genes, it can come to you.
Much likelier that you will be bald.
It is much likelier, but then there are multiple additional factors which contribute to this. Nowadays, as you see, a lot of people, so previously we were seeing balding in 30s, 40s or 50s maybe. Nowadays, we start seeing a lot of individuals in younger age group who started falling into this hair loss problems and getting bald at 19, 20 also. So this is because of multiple factors like stress, sleep, improper dietary habits, water, pollution, environment, hormonal, everything contributes to it. Majorly, I'll say it's hormonal, but yeah, there are multiple additional factors which contribute.
In percentage, how much is genetics versus how much is lifestyle?
I cannot say in percentage, but yeah, majorly it's genetics, but then there are other contributing factors.
90% genetics?
Can be said 70%, 75%.
75%. Baki, it's stress.
It's stress and other factors. And the lifestyle what we have today.
Don't you think like all those lifestyle factors which go wrong, like excess smoking or lack of sleep or drinking, actually is because of escapism which happens because of stress anyway?
Yeah, finally it is, stress, you need to run away from stress, and that is how, it's a cycle.
Okay.
Agreed.
But all of us are ambitious guys and stress is going to be a part of our lives.
Yeah.
So if you are balding, firstly, I think, and my take on this, and again, like I have not faced that exact problem because of genetics. Like no one in my family, none of the guys from both sides have had a balding issue. So I can't completely relate, but I've had a lot of friends go through this. I want to begin this podcast by saying, hey bro, It's normal. Relax. There are biological solutions. Fair to start
There
like
are
that?
biological, there are surgical, there are multiple options available. We are in a stage where we have solutions for everything, so there's nothing we need to stress about.
Okay. I've had friends who used to have hair thinning when they were like 18, 19 because their parents also, had some kind of
Yeah.
hair thinning. As in the dad, not the mom. But, uh,
I'll have incidences where mom is also balding.
oh, really?
That's very common now. I'll come to that.
Even women bald.
Yeah, why not?
Why do they bald?
It's the same hormone.
Dihydrotestosterone.
So basically, there is a theory where a male and a female, the androgen receptiveness works in a different way, where you see balding in men on the scalp and excessive hair growth on the body, and it is reverse in female. Though it's the same hormone, it's just receptiveness what our anatomy has done. But again, multiple hormonal issues like PCOD, PCOS, thyroid issues, stress, post-pregnancy, menopausal, all these women start facing a lot of thinning and scalp is visible. So I'll not say women also goes to a stage where the scalp is completely shiny like a man, but there's a lot of thinning and the scalp skin is visible. And from women, aesthetically, you need to be 100% sure. So there are options available and there are reasons for it.
Wow. Okay, this is the first time I'm hearing about women going through the process of balding.
Yeah.
You get women patients
A
also
lot of
go for-
women, and I've done a lot of women transplants also. I'm very nicely, and I'll discuss that in brief for sure.
Okay, I'm gonna cut to the chase. I had a friend who went through intense balding when he was 18, 19. Okay, and he was going through a stressful time in life also. And I saw him be stressed until he jumped into this hair transplant solution. And he had a conversation with me where he made me sit down and he's like, bro, if ever you get a chance to talk about this problem on TRS, firstly, it's very common. Secondly, tell everyone to directly go for hair transplants. Is that the correct medical advice?
No. So, if you allow me, I'll brief you about the entire journey. What is the right approach for it? So, for a patient, first thing is I'll just quote something where people don't know what they can get unless you show it to them by Steve Jobs. So, we have to evaluate the patient first. We have to plan the entire procedure. We have to explain the procedure, what the procedure is, how it works, who should be doing it, what you can expect. So if I have to say first thing, assessment, evaluation of a patient. First, you have to consult a doctor, get it consulted, understand the problem. What is it? Hair thinning, whether it is baldness, whether it is a complete baldness or just hairline is receding. As per there are different scales like Norwood scale to grade the baldness stage 1 to 7, whatever stage you are.
What's the difference between hairline receding and balding?
So it's like someone who's just balding from the front, someone who's balding from the crown, someone who's having a complete baldness. So it's completely different, and we have to first evaluate what is the concern of the patient. Second would be in a transplant, I'll explain in detail, but in a transplant, we take follicles from the back of the scalp. That's the donor area. So we have to be very sure that the donor area is very healthy. Okay. If the donor is not healthy enough, we'll not be able to plan the procedure properly. We may just overcommit it and we may not be able to give justification. So we have to set realistic expectation to the patient. So evaluating the donor area is very important because I cannot use someone like your friend. I cannot use your donor in your friend. It is body will not accept it. It will reject it. So evaluation assessment is very, very important. Second step is planning, where we have to explain it to the patient that hair transplant is, we are not just implanting hair follicles anywhere. It's a craft where we have to match with the face, we have to match with the age, set realistic expectations to the patient.
There's an art attached to it.
Yeah, it's an art attached to it. There are a lot of skills required for this because you cannot have transplants in different angles growing here and there and not designing the hairline properly. In fact, we explain the patient, we take out some testimonials of our previous patients who are in a similar stage of baldness to give realistic expectation and tell them what they can achieve. There has to be very realistic. Last thing is hair transplant. Now, transplant, I'll take more time on this topic because this is something very simple. Scientifically, logically, I'll explain it to you so that everyone understands on your thing. So, transplant, it's a two-part process. One is extraction, where we extract follicles from your body, that's your donor area, backside of the scalp, and implantation in the recipient area, wherever you're balding. Categorically, across the globe, hair transplant has two types, FUT and FUE.
Hold on, I have to pause you because I speak for the people.
Yeah, please.
Doc,
please.
very openly, just from your experience, how much does this cost? because that's the
Yeah.
concern for a lot of people. So let's talk about the
Sure.
cost at the start. And I know that the cost varies depending on follicles.
Yeah.
But-
So it's not, so that is a complete commercialization. To be frank enough, number of follicles as a patient you'll never be able to count, because it's like 5,000, 8,000, 10,000. How are you going to count that follicles? It is just a commercialization way, or maybe to charge accordingly. For us, what we charge at a Shaw Clinic is completely based on the experience of the doctor who's operating it. So here I'll tell you, across the globe, I find only where we are the ones where start to end a procedure is done by a MD doctor, including myself. I prefer doing the procedure start to end. I don't like technicians, where across the globe it is the major thing, where in fact people who are making the guidelines, I'll not name anyone, but in India or globally, they've created a smart loophole in between where they've said that extraction can be done by a doctor because it's a small process, skillful for sure. And along with that, implantation can be done by a technician under a doctor's supervision. You tell me, Ranveer, supposedly, touch wood, you have beautiful hair and I don't see it losing very soon. But if you come to me and considering ki you are balding and you want a procedure done, you come to me because of my credentials, my qualifications, my experience. You've researched about it and you've come to me. And when you come and I just say, ki, Ranveer, I'll be planning, designing, and then some technician will do the job under my supervision, what's the point of my credential?
No,
It's a
fair.
complete waste.
See, I don't think you should think about the price when you're paying for an experienced MD certified doctor.
Right.
But still, doc.
Yeah, still I'll tell you the price. That's not. So depending on the requirement, our approach is different. The number of sessions, number of grafts, whatever is required, and what are the sessions required, and who's operating you, how complex is the case. See, every case is not that simple. You'll see a lot of failed transplants done by bad job done. You have to correct the surgery. You have to invest more time and effort. More experienced surgeon would be required. So we have different categories like 2-year, 5-year, 7-year, 10-year senior surgeons. With Assure, with myself doing those cases, and accordingly it may range from something from 2 lakhs to 10 lakhs for the procedure.
2 to 10 lakhs is the range depending on the degree of...
depending on the experience of the doctor. Degree, it's like 3-4 category of doctors who are allowed to do, like a dermatology, a plastic surgeon.
No, I meant degree of hair loss.
Yeah. The grade of hair loss, what are the sessions required? Like hairline may be covered in 2 days, 3 days. Full head may require 7 to 8 sessions with intervals in between.
But the most expensive that this procedure can go to is about 10 lakhs, roughly speaking.
That is what we charge. There are doctors charging 50 lakhs also, and there are clinics doing 50,000 also.
50 lakhs?
Yeah. It's a wide range depending on what VIP client you're treating and what VIP service you're giving. And still, I'll tell you, even a 50 lakh doctor, where it's very common, people know who those people are, will not do the implantation, will be done by a technician.
Gold-plated hair. Why 50 lakhs?
And that too, which is supported with medicines, which is a huge controversial topic over here.
As in?
So you must have heard about minoxidil finasteride.
Yeah.
It's a very, very commonly used medicine. If you allow, I'll talk a bit more on finasteride because I need people to be aware about it. So finasteride was a drug of choice which was given for benign prostatic hyperplasia. So that's an enlargement of prostate gland in a male elderly individual. Surprisingly, people found out a positive side effect that people who were taking it for a longer time could see a significant reduction in hair loss. Researching more on that, finding that it's a blocker to form less DHT, that's dihydrotestosterone, what I discussed. It was considered as an FDA approved for male pattern baldness, androgenetic alopecia. My concerns were this medicine has side effects like erectile dysfunction, decreased libido, decreased fertility. It has a post-finasteride syndrome, which is registered in journals like American Andrology, European Andrology. There is American Reproductive Journal, which states that. And they've assessed this using multiple scales like Arizona Sexual Assessment Scale, Aging Male Symptom Scale. So it's purely recorded. The percentage is less, but it is there. In fact, there was a lawsuit filed against Propecia, known as finasteride, where almost 1,000+ men had alleged these kind of side effects of erectile dysfunction and libido and depression, suicidal ideations and all those things. And they had to settle this at a $4.3 million, which just concluded last year in 2023, June. This was in USA in 2012. So these side effects are there. Now my concern is these medicines are easily available over the counter. specifically in regions like India. And most of the people lack awareness, self-administer these medicines without proper medical guidance.
So 1 second.
Yeah.
The realistic scenario is a guy starts balding. He reads on the internet that take finasteride and minoxidil.
Right.
He goes to the chemist shop,
Chemist.
goes and buys it without understanding that these medicines have side effects.
Not minoxidil, but yeah, finasteride. Minoxidil is a topical application. So also minoxidil and finasteride are the medicines. First, it will work only till the time you take it. Second, it is not helping you in regrowth. You, as you mentioned, your friend 18, 19 start facing. So those patients may experience a delay in deterioration of hair loss, but not in regrowth. And also adding, because it's a lifelong obligation. It is not something which you take it for 3 months, 6 months and that.
That thing you said about erectile dysfunction, once you stop taking the medicine, does your sex drive and all come back?
It does. That is what it is said. But when I said post-finasteride syndrome, it states it's a persistent sexual, neurological and psychological side effects which has been observed. I'll not say 100%, but there are still studies to happen. And you're risking something for your aesthetic appearance, a lot more you're risking it. A dermatologist not guiding this properly, not evaluating a patient. How many of the patients who visit a dermatologist does a fertility profile check done? Nowadays, IVF is so common. Why? Because people are not aware. They might have some issues with their hormones and everything. And adding to this, if they have this, they may end up having more infertility issues. So I completely refrain myself from advising these medicines. In fact, my take for your audience would be, before starting this medicine, consult your doctor, consult your dermat. Ask them what are the benefits of these medicines, how long you have to take it, what are the risks involved, and what happens when you discontinue the medicine.
This is such an important podcast for bros, honestly, because the thing is, as a guy, when you're dealing with some cosmetic insecurity, you're ready to do almost anything to fix it. But guys don't understand that certain medicines have certain bad effects or could have certain bad effects on your reproductive system. So you have to be careful when...
We have to evaluate and we have to be under proper medical guidance, and whether you have to evaluate yourself whether the risk is worth taking.
Okay.
What are we risking at?
I just want to mention that doctor is a gold medalist doctor in your MD, right? Not all doctors are the same kind of...
Depends where you get it done and what is it. But once we do our masters, the competition is already less.
Because you're in a newer category.
So yeah, the fields in it streams down to very few seats in a particular field, and my dermat happened by chance. So after my MBBS, when I was opting for a master's thing, I had dermat and other field as an option, and it was you can say a gut feeling or an intuition. I just selected dermat, and there's no looking back from there. In fact, it was destined to be a part.
Simple question to you. You're able to kind of spot who has got a hair transplant and who has not, right? Thoda bahut.
Right, for sure.
Because it's your kaam dhanda, it's your bread and butter.
100%.
We all know that many cricketers have got it because bros keep a track of how cricketers look. We can actually tell which cricketers have got it also. But without taking names, because I am a fan of certain cricketers, there's some cricketers where you won't even believe that these guys have got it. But when you very, very closely check each IPL season, you realize, there's a change in the hairline. Where you
Nowadays, social media, people who are not even closely looking at get to know about it.
Right. Yeah. I went for a shoot once where, can you see these lines here? Like I have lines on both sides where some people would believe that this is male pattern baldness starting. Now I am very happy and proud of my own hair, and it's genuinely genetics, and I take care of myself also. But a makeup artist once, while doing my makeup, had scared me a little bit, saying, "Arey, ye dekho, your baldness." And this was like 3-4 years ago. Nothing has changed since then.
Right. So this is a normal hairline, which after you cross 20, the body takes a formation, and that's a normal hairline. But I'll say not even grade 1 baldness. It's a normal thing.
Is this any kind of baldness?
Not at all.
Because my granddad, who was like he passed away, but even till the age of 90, he had a similar hairline.
Yeah, this is completely fine. This is not... So baldness is not just receding. It is overall thinning, which you start seeing. What I explained at the start, that the thick follicle goes to a terminal fine follicle. That is when you see baldness.
Okay. And
in your case, you can take my word. Next 20 years, you don't have to even look.
How can you tell that from looking at
That is completely my experience. And I've been seeing like last 10 years, I've seen n number of patients. I don't want to number it, but yeah, I've been doing day in day out procedures. So just taking, I can identify a person by his head, not by the face. I had a patient in young 30s, obese patient, very lethargic. You can make out what kind of lifestyle he might be having, and completely bald. But luckily, he had good donor area. So we just did a transplant, an amazing transformation. But when he was looking himself in the mirror, he realized his self-worth and confidence, and he started working out on his body, on his health. Trust me, he has 6 packs today. He's modeling for some agencies.
Wow.
And has changed his lifestyle, and I believe this lifestyle for generations must be changed,
Yeah.
because this has completely transformed him.
What's the major insecurity that your patients usually have when they come in, and have guys cried in front of you?
Yes. So there's a lot of social pressure. There's a lot of pressure at professionally also, and there's a lot of pressure who are of marriageable age. A lot of insecurity, a lot of stress, a lot of anxiety develops considering the external appearance. For me, I'll say hair isn't everything, but since, yeah, if person has an option to restore it, get it naturally back, and have a good full head, and gets him the confidence, you should do it. So that's what the take is. But yeah, people have gone to extremes. People have had depressions, anxieties. People have been put on medicines just to take care because of the external appearance. And young generation people will not behave that maturely, and may in group of people may comment, and they feel always left out in a group of people. A person who's balding will feel left out,
Even if they're not actually left.
yeah. So because people start commenting, they'll comment on someone, they'll relate you to some elderly person, or such kind of things happen. And then that is what, because at this age you are developing a personality. At 2022 you are just getting exposed to the outer world, and when you start seeing this, so that makes you a bit back. So that is what I feel.
I want to say 2 slightly controversial things. The first controversial thing is, Doc, you're such a good guy. You're so calm. Like, I feel more confident around you. I feel like if we were in college together, you'd be the guy I'd get drunk. You know, I'd like force you to have a lot of shots.
100% I would have. It would be on the other side.
I'm the bad influence guy.
It appears like this over here, maybe.
Like, I really want to party with you and really get you smashed. I want to see that side. The second thing I'll say, which is controversial, I really started getting a good amount of spendable income only at 28-ish, and that was a very voluntary choice, because till 27 I kept reinvesting in business and all. So I started investing in my own lifestyle at 28, 29, 30, and I saw how much it enhanced my state of mind. Now for me, that could be as simple as, like, I've had a lot of skin trouble going on over the years. When I found a good skin dermat and stuck to it and realized, oh, this is the effect of it, it really changed my quality of life. But it happened because I could afford it, because I worked really, really hard from 22 to 27 to be able to pay her fees. I really feel young guys who are dealing with hair loss and who think that 2 lakh to 10 lakh rupee range is too much, I think you should use that as a motivation to work really hard. It's 2024. Figure out how to make that kind of money.
Still, I feel it's 2024. Transplant is basically almost a minimal maintenance thing, to be frank enough. It's an investment, one-time investment. 90% of the people you come across using iPhones as a trending thing, which is costing 1.5 lakh, which is not going to last for a year or two. This is something you're developing a personality for years. So there's no harm in investing. Also, at the same time, there are so many EMI options and so many options available across where you can easily manage that. Something you can invest on yourself, which is going to get carried all your life.
There's EMI options for hair transplant.
For hair transplant.
Really?
Yeah. And so many banks at 0% interest.
Hair loan.
Hair loan.
Really?
That too pre-approved. Just on your KYC.
What?
Yeah.
Why has this happened?
So people, as you mentioned, people would not want to shell out 2 to 10 lakhs in one go, and maybe look for EMI options, which becomes easy on their pocket also, and gives them the time frame to do that. So a lot of banks, I cannot name the banks, but a lot of banks are there with tie up with us also for EMI.
Okay. Damn. What I want to say is that I have a mentor called Gaurav Kapoor. He does Breakfast with Champions, the show, and he inspired TRS in so many ways. He was one of our early guests on the show. I asked him to give me the best money advice for my 20s. He said that roughly 30% of your income, anyhow, save, like whatever you can do. Try reducing your lifestyle expenses. Like, don't buy too many expensive things and all. Be little frugal in your 20s. But definitely, there should be a chunk of your income that you spend on yourself. Now, that could be online courses and upskilling and all that. It could be classes for something. Or it could be cosmetic. Invest in yourself. Invest in your gym fees. Invest in your yoga class. Invest in the cosmetics-oriented doctors. This can really change the quality of your life in your 20s. And the moment your quality of life changes, your thinking patterns change. When your thinking patterns change, you actually can figure how to take your life forward, both from a perspective of relationships and your career. Right?
100%. In fact, I have the saying, investing time in how to save money, invest your time in how to earn more money.
100%. This is not spoken about enough. I think that mentality switch is happening in our country where people are...
Yeah, India is growing like you have so many opportunities. Every second person, if you work hard, if you give your 100%, whatever you do, there's a scope to earn, to have a very decent life.
Yeah, because the information is available online if you're willing to look for it.
Yes, for sure. Everything.
The craziest career that you can think of is learnable off of YouTube now. So the ball is actually in your court. Doctor, back to this dermat conversation. Do you want to talk about the hair transplant procedure first? And then we'll go to the other procedures related to minoxidil and all these creams and all that. First question is, when it comes to these hair transplants, totally out of all the men and women coming to you, what percentage of people should actually be going for hair transplants?
Again, as I mentioned, we need to evaluate who's the right candidate for a transplant, who should be doing it, when and how and where. So that is how completely on the evaluation, how the patient is coming and what is the expectation requirement.
If you see 100 patients in a week, how many of them usually end up going for some kind of hair transplant, which is surgical?
See, 100 patients who are coming to me, they know they're coming for a transplant. Well, they've lost hair at some place, or for sure. They've researched enough and they've lost hair. Now, how much is the conversion? Depends on multiple factors, time availability, downtime, they have leaves, work-wise, or whatever it is.
How much time do you need?
Depends on the requirement. I may need 2 days, I may need 3 days for a patient, because my approach towards the patient is different. I'll explain when I do a transplant. So, depending on that, again, commercially also, they have to plan it accordingly. But finally, I feel someone who's visited me, 100 out of 100 will someday or the other go for a transplant.
100 out of 100?
Yes. If they've already come, that means, see, nowadays, Google is something which you do first before doing anything. So you've already researched and you feel you are more educated for sure than the doctor. You'll ask more specific questions.
Honestly, 2 years ago, I would have come to you. I would have, because I was told that, listen, you're starting to bald. So do you get patients like that as well?
Some, very rare, but people understand. Like in your case, I'll straight away say, don't do anything, don't use any products, don't get into hair care extremely, because your hair adapts to it, the environment. You start taking more care, you start using supposedly you visit a doctor who's over into a person, since you coming as a patient, a doctor would want to prescribe something or the other, and just for random sake, if they ask you to use minoxidil, it will damage more. You don't use it regularly or you discontinue, it will not adapt and cause more hair thinning and loss. So we have to be very cautious. Not just every patient entering, we have to tell them that you have to take medicines.
How do you even know that you should go to a hair doctor? Say for like an 18, 19-year-old in college.
So it's a very simple thing. Normal hair fall, what happens, what I said, normal shedding, 50 to 100 fall a day is normal. When you start observing excessive hair on your pillow covers or on your shirt and everything, you should visit a doctor. You'll start seeing the volume is reducing, there's thinning overall, the density is not the same. You can visit a doctor just to evaluate.
Okay. And it's a normal thing. It's happening to a lot of people.
A lot.
Because that's how human beings are also evolving. We're evolving into being a more bald species. Right? There is a theory.
That I'll not let that happen.
But over like 1,000 years, I think the way genetics
I'll not say over 1,000 years, but over next couple of decades, I would want, in fact, every single person in India say baal achhe hai.
Because of good hair transplants. Fair to say that in 1,000 years, everyone will need hair transplants?
Too long a vision to see right now.
Because of how the human evolution story is going.
Possible.
Everyone's becoming bald.
Yeah. Then there will be more options also available. For sure. There's a lot of research going on. So Yeah.
You know, Kida I have is like seeing my girlfriend's dads or uncles. Am I like getting into a gene pool which will pull my children towards like.
There'll be good solutions in next 2 decades where we can always preserve for a longer duration.
Okay.
Or maybe by that time bald would be more beautiful.
Okay. Back to the hair transplant conversation. I want to again begin this with a chapa of 2 lakh rupees to 10 lakh rupees, roughly speaking. It can be anywhere in that range depending on your degree of baldness. Okay. The next key question I have for you is how much does it hurt?
So again, hair transplant can be a completely pain-free procedure. See, what people do, there's a lot of commercialization across the market, a lot of cost-cutting things happening. Anyway, anyone you know, I'm sure they would have done a transplant. It must be a 1 day, 12-hour, 14-hour job, or maybe 2 days extending, or else Turkey or something like that. So that causes a lot of pain, patient compliance, doctor compliance, technicians doing the job. What we do is supposedly, hypothetically, have to do 3000 grafts. I'll distribute that over 3 days, 2 hours each day. It is under a local anesthesia. So normally it won't hurt at all. And people are comfortable, the kind of procedures we do, people are comfortable to get back to their routine activities on the days of procedure itself. In fact, I don't even restrict them for major things.
Okay.
So I'll not say it's a painful procedure. Mild discomfort would be there, but that's completely acceptable.
Okay, please correct me if I'm wrong. During a hair transplant, basically what's happening is that if you are eligible for it, that means your hair on the side of your head and the back of your head is healthy. And it's thick. There are enough follicles there to be removed from there and transplanted on the top and correct your hairline. So the first process in a hair transplant is pulling out the follicles medically
Extraction,
correctly, right? So that you're keeping them alive. You pull them out from the sides and the back and basically place them at the top. And the art required here is near the hairline. How do you place them in such a way that it doesn't look like someone has drawn on your face?
Yeah.
Correct? Do you want to add anything to the procedure?
So procedure, I'll like to explain it medically also and the difference also. As I was mentioning FUT and FUE, I'll directly come to FUE because FUT is an old school technique. Mostly people don't follow and don't practice. FUE is a follicular unit extraction where, as you were mentioning, extraction of the follicles from the safe zone known as the donor area. Now, extraction also is an art and it requires a lot of surgical skills and experience. Reason I'm saying, hypothetically consider a person who's just having this much and he has to cover the entire head, the grade 7 bald person. The follicles what we are extracting is not going to grow back. So even a single follicle getting damaged or wasted is a waste from your body. You cannot replace it. So normally what happens, if I have a pen.
Yeah, go for it.
So hypothetically, consider this is a follicle. This is a motorized machine with a punch. It goes, cuts the attachment, we take out a follicle. This is very simple, okay? This size of the punch what we are using matters a lot. If it is a bigger punch, what will happen? The adjacent follicles what I'm extracting will get damaged. So if I'm extracting 3000, I'm damaging additional 3000 and scarring the donor area also. Here your doctor's experience, skills and everything comes into picture where we are using more finer, more conical punches, 0.7, 0.6 and able to extract more number of grafts without damaging it to take care of the entire supply.
So when people go to an unqualified person, this is what can go wrong.
Majorly. This is what has been going wrong in a lot of patients who travel to Turkey.
Where did this come? What is this Turkey angle?
So Turkey has been very popular, if everyone knows, for hair transplants. Like at one point of time, any point of time, you go to airport, you'll see 10, 20, 50 people with the surgical cap going for procedures. So basically Turkey is way ahead of the curve in terms of medical tourism and hair transplant because of accessibility, strategic geographical position, European countries, Middle East, Asia. It's very, very easily accessible and affordability also. Like Turkey, if I'm not wrong, they'll give you packages of like 2 lakhs, 2.5 lakhs for a procedure, travel, stay, tourism and everything. They'll prepare the itinerary and create everything and give you the present. So it gets attracted for sure. But the kind of popularity doesn't indicate or equate with the superior quality procedures. There are very restricted guidelines where whom should be doing the procedure. What are we risking in terms of this is we are risking patient safety, results, and finally we want a transplant. We don't want a vacation. For that we can plan it otherwise. So the entire focus is shifted to commercialization and planning the entire medical tourism kind of thing, but the major procedure what is required is not done nicely. In fact, once we started our clinic in Dubai, I could see a lot of patients where we started doing corrective procedures, blotched up transplants. That's an edit thing what we have.
What do you have to correct?
So correct in a sense, understand a bald person is very beautiful. But a person who's had a failed transplant, consider some hair growing this side, some growing there, there's a lot of gaps and looks very bad. It looks ugly in fact.
Oof.
So we have to correct. Now the donor is already damaged. In fact, I'll tell you a very interesting story.
You ever seen WWE?
Yeah.
There was a scene where Kane took off his mask for the first time.
I don't
You
remember
don't know?
that.
Okay. That was exactly what you're describing, where hair is growing randomly.
Randomly any direction. So I had a patient, in fact, who had undergone 3 failed transplants. One in Dubai, Turkey, and somewhere in Delhi. FUT and FUE.
And the cumulative expenditure would have been...
Expenditure, more than that, he had invested his time, his hope, his trust, and he was expecting something. He had completely failed transplant. You'll see the patient must have lost his smile. So,
But why 3 in a row? I mean, this comes...
It must have come over a period of 3-4 years. He
But-
would have tried.
According to me, it comes from mentality of trying to save that little money.
No, it was enough money spent in a well-educated person. But the entire concept of who should be doing the procedure is not there on the internet also.
What is it?
So that technician shouldn't be doing, a doctor should be doing the procedure start to end. So in this patient, when he came for the 4th time, Dr. Priyanka, my wife, she happened to inquire what motivates him to come for the 4th time. So he was very blunt enough to say, Ki, I've done 3 times, it's failed. Even if I fail for the 4th time, I have nothing to lose. So this was his mentality, and he had researched a lot about complex cases and everything. So it was not only a challenge for me, it was my moral responsibility to deliver something. We are good. I could manage, I could deliver him. It was successfully done, and he's very happy that finally he could get his hair back, and the donor area is still preserved, that doesn't look patchy and scarred. So we get to know that we are here for a purpose, and we can deliver if we go out of the way to do that.
What had gone wrong in those 3 previous surgeries?
I believe one, as I mentioned, the bigger punches, the scars and everything, and implantation is very important. It's a very time consuming, it's a tedious, laborious job, what people say. But that is very important. Like for a 3000 follicle, as I mentioned, I'll take 3 days of 3 hours, like 9 to 10 hours behind a patient. I would want personally to do it. I don't want technicians to do a job and just keep observing it.
Can we go back to the procedure again?
Yeah. So again, extraction, as I mentioned about the implant also simultaneously, we follow a different technique where every hair wave, every angle needs to be maintained properly. Like crown has a circular pattern. If you observe anyone, it has to be in a circular pattern. You cannot put 90-degree angle and hair standing out.
Right.
It has to be in circular. Front hairline, as you mentioned, it has to be natural looking, fine hair follicles in the front. And all those things needs to be maintained, the depth of the follicle, the density of the entire balding area where we are covering. So everything needs to be maintained. So this is the procedure, extraction, implantation. If it's a low donor case, divide it over multiple sessions. Don't hasten the process, just try to complete in one day. Divide over multiple time. It's something you're giving it for the life. They can invest 3 days, 4 days extra for that. And do it in an aesthetic way so that you can deliver results which are permanent.
Respect you, man.
Thank you so much, sir.
Helping a lot of guys going through a lot. Because all of us, no matter what our age is, we're boys on the inside. And you want to look in the mirror and feel like a boy on the inside.
100%.
So this is one of those aspects of nature which takes away your own sense of boyhood. And this is why I respect doctors immensely. Not just doctors like yourself, all kind of doctors. Because everyone has, this kind of moral angle. That's what I've seen with all doctors A to Z. They may be a good doctor, bad doctor, it doesn't matter.
Yeah.
Internally, the core is moral.
Yeah, we get that satisfaction. In fact, I remember how I get Diwali wishes is 40, 50 year also will click a selfie and send me a happy Diwali. So he's so happy that the blessings are coming to us, and that motivates us to do better.
Yeah. I see a lot of doctors saying this, that the so-called money you earn as a doctor, it's actually, I'll take that. Other than like just money, you earn blessings of people whose lives you change.
For me, though, it's more than that, because for me, though being an aesthetic procedure, my patient would see themselves every single day. I feel if I've done a good job, the blessing will reach me every single day. The more I do, the more blessings I'm going to get.
How does this experience of life feel over the long term?
So experience in the sense, it's as a person, I'm too enthusiastic. I am deeply passionate about my work. Like I like being hands-on with my patients every single day. And
Because
simultaneously, yeah,
you're getting to help a bro.
yeah, maybe I'm getting a satisfaction. It's a complete work satisfaction what I'm getting, and it's a different perception what people have, that it's a very tedious, it's a monotonous, it's a laborious job. And in fact, my colleagues also come and ask me, when there are guidelines, technicians can do it, why you want to get involved in yourself? I feel I remember a conversation with my mother-in-law. So she says that when you are very passionate about something, it's a kind of meditation. It gives you, energizes you more than draining you. So for me, hair transplant isn't a job. It gives me a good fulfillment, a good sense of therapy for me, that I love doing it every day. So
People think for me that would be podcasts. Like podcasting would be my meditation, but it's actually only good podcasts, and this is a good podcast. Speaking about the topic again, I love what you said about that swirl, the hair swirl, the angles of the hair. I think this is what separates great dermats from good dermats. That they look at the face and the head as a piece of art and deliver for their patients from an aesthetics perspective as well. Without taking names, cricketers and actors have come to you.
Yes, a lot of them, but I completely respect
Doctor,
their
patient.
professional and personal commitments, what may not. So I have this key up, celebrities. Some celebrities promote hair transplant. That is good for awareness and taking away the social stigma. And some, maybe because of their personal professional commitment, can't. But yeah, so for us, every patient is a celebrity. So like everyone needs to be delivered safe.
Yeah. Specifically with actors, their job is related to the face and the hairline and all. So the risk factor is so much higher for these guys.
100%. They have to be constantly in front of camera, under the light. We have to be very sure about the density, about the natural looking hairline, about merging with your existing hair. It shouldn't look patchy and everything. Yeah.
Let's talk about all this, the art of it, little bit more, just so that guys who are, there's lots of guys who are already considering this from a medical perspective. There's a bunch of them who can probably afford it also. But I think this is another very, very key factor, which is not spoken about enough, the cosmetics angle of it. In terms of, you spoke about the safety aspect of a doctor doing it.
Right.
But an artistic doctor is also a requirement in this case.
Right, 100%. Again, the artistry, doctors are well educated after getting their qualifications, but they need to have an experience. And experience is there only when they hands-on do it. See, then there are not much institutes which will train you for hair transplant. In fact, during our masters also in dermatology, we were not inclined or trained towards transplant. It was where I was working and I could see a lot of transformations, happy lives. I thought, yeah, this is what I'm doing it. So I personally got involved in implantation also. And trust me, till date, wherever you go, whatever you pay, technicians doing the implant, I'm not saying they're doing a bad job, but there are very minute things which need to be taken care of. As we mentioned already, the design of hairline, how much we can use the donor area. I should be very sure that I'll be able to extract 7,000, 8,000 to distribute it. Or what will happen is I overuse the donor area, I extract 3,000, 4,000 and just do it in the front. Backside is completely bald. Then you have to increase the length of the hair, camouflage the area, all those things. So planning is very important. And every hair implantation, you will see a lot of patients where they create a slit, push the follicle with a forceps by a technician. The skin is an elastic tissue. It starts closing on its own. By the time supposedly you come from left to right, you will see a lot of hair follicles popping out on the skin, like a doll-head appearance. So those kind of things is not accepted. Finally, it's an aesthetic. Do less procedures, but do it yourself. I'm sure a doctor will 100% deliver much better than a technician.
I'm sure if I keep asking you questions about the artistry of it, you can keep breaking it down further, because
each follicle, divide the sessions, give enough time for a patient. Don't hasten the process. Don't go for cost cutting. Do it expensive. Charge them more, but deliver the best.
Okay. I hate doing this because there are guys who have sort of hairline trouble watching this podcast. So I'm not doing this from an egoistic perspective at all. But again, this is what the makeup artist has told me when she was examining my hairline. She's like, you have a natural, decent hairline at the top. So if you actually observe the hairline, it's not straight.
Yeah, that's how a male hairline would be, and that's a natural random follicle placements, single hair follicle placements. Micrografting needs to be done in the front, and that is how the thickness goes.
One of the reason I'm bringing this up is because the key sign of a bad quality hair transplant, which on the surface might look like, it's all right, but actually it's not great, is when all the hair at the front is in one line, and it's very obvious that
It's very obvious, and if you're using, so basically a hair follicle unit, it may contain one hair, two hair, three hair, four hair when you're extracting from the donor area, or up to six also. So you have to be very cautious. You can use only single micro grafting from the lower side of the neck in the front two lines, which will give you the natural look. The angle of the hair should be proper, and there shouldn't be space in between the follicles, so that the density, you will not see a normal person, like consider you have good quality hair, you will not see hair space in between the hair follicles. So that is also very important. So all these things, micro things, are very important in transplant.
do guys come to you for filling up this space as well?
I will not do that. Yeah, people come with a different perspective altogether to change the hairline, change the direction of the hair, or have a different. So how we design a hairline is medically defined. We divide the face into three parts, and then it matches something with the jawline what you have. You'll always see a M-shaped, V-shaped hairline on a male and a U-shape in a female patient. So that's a common anatomical features which we need to be aware of before designing and planning. Patients do say, "I want this, I want that," but we explain them in detail that once we do it, it's very difficult to undo it. So be sure, let them grow, you'll be happy, and if not, we can always modify it.
Okay. This question is coming out of a place of random curiosity. Say a hair transplant has gone well, okay, from all the aesthetics perspective you spoke about. Can the transplanted follicles grow into long hair?
Yes.
Fully?
People have tied buns and long hair, they can do it. It's a natural process. It's your natural hair. You cut it, shave it, color it, style it the way you want it.
Okay. One more C question for you, okay? Can I do a hair transplant and actually grow out a beard?
Yes. I've had a lot of beard transplants.
What?
Yeah.
That's a thing.
Yeah, that's the thing. People who don't have, unfortunately, the follicles are not there, we do transplant. Beard, eyebrows.
Eyebrows?
Yeah.
Why eyebrows?
People who don't have eyebrows can get a eyebrow transplant also.
Okay, like if it's gotten
damage, there's a surgical scar or something, or there's very fine. In fact, my eyebrows are very fine. So yeah, people can do it if they want it.
Love biology.
Everything is possible.
Love 2024.
In fact, to have a funny side on that, people use hair from every part of your body to get it grow on your head.
Like pubic hair.
Pubic hair, axillary hair, that can be done. We don't prefer it. That's not the quality it will match, just camouflaging the area, but that is a science where we can use everything.
Damn. But what's the need to use pubic hair?
When donor is restricted and we have a huge area to cover, as we cannot use someone else's hair, we have to use your own body hair. So we use hair from beard. Beard is still good, but chest hair, back hair, pubic hair, axillary hair, everything can be used.
So the best case scenario for a hair transplant is actually using the sides and back of the scalp.
Safe zone of which is known in the medical terms as a safe zone.
What is option 2? If you can't
add beard. Lower border beard below the jawline, randomly, uniformly taking it so that nothing is visible.
But then nothing will grow
No
back?
scar. No, the follicles what are taken will not grow back, but it is camouflaged and merged and taken in a way that appearance-wise it's normal and there's no scarring.
Damn. Third option?
Body hair.
From?
Chest.
That's
the maximum what I do. Yeah. Chest and back.
But there are people who take armpits and all.
There are studies and people do that, I know.
Studies?
Yeah, people do, and
as in it's being researched.
Yeah, being researched, and people have done that and people have successfully done that. But the quality of hair on your body will never match with the scalp. Beard is still fine, in fact better because it's thicker, so it can add some volume to your scalp hair. But body hair, it's always curly, different texture, and doesn't match with it. Just camouflaging the area or refilling the area in a bit.
Never even thought that beard transplants could be a thing.
It is.
People want to get beard transplants from what perspective?
To get their manly look back, maybe, for the comments, or not having proper. So beard transplants, if you see, we don't, our Asians, we don't have a completely fair or a plain skin. We have partial growth somewhere. So that is what people want to groom themselves more, and accordingly they do a beard transplant to have a very uniform growth all over.
Is it painful?
Not at all. In fact, it is as comfortable as your scalp hair transplant. In fact, more because the skin of your face is very lax, very soft. So you don't even realize anything.
Damn, dude. I'm considering a beard transplant.
I don't
No,
think so
no.
required.
Not required.
I've not seen you with a beard, but maybe you have partial growth.
I mean, I also have a good boy image.
Yeah.
But
A chocolate boy. Maybe someday you actually get into a conversation for an arms deal. So yeah, you'll need that.
I mean, see, the thing is what people don't understand. In my heart, I'm still that same science student, okay? 11, 12, doing CET, going to engineering college, EAO. And as I went into media, I realized how much looks are broken down, gauged. And every year I learn something new. There's so many people who told me grow out a beard. Now, I don't know how I can tell them that nahi hota yaar. Nahi mere se.
Try someday.
It's just, it's not.
Yeah.
See, the thing is, my family is blessed with great scalp hair genes and really face hair genes. Like no one has a beard.
So that's what I said. That's an androgen receptiveness. You have good hair on your scalp, less on your body.
But my testosterone levels are great. Like I'm a physically strong
100%.
guy. So it's nothing to do with my manliness, right? There's no testosterone. Like, okay, just checking. But guys like me come to you for beard transplant.
Yeah, a lot.
And you say yes or no based on what?
We almost beard transplant. If it's required, then we do it. There's no restriction as such.
Is this mainly actors?
Not really. Every common individual is now very much concerned about the looks.
This is a very North India thing though, like where I have a lot of bros from North India who ask me, dude, you don't feel bad or that you don't have a beard? And I'm like, not really, dude. Like, it's fine.
A lot of people get influenced with the celebrities, so there will be a trend suddenly coming, people seeing Sunil Shetty, Ranveer Kapoor having good beard, so they would want to copy that.
That's it. Okay. I mean, I might be wrong, but there used to be a massive beard trend in the 2010s.
Yeah. I remember a company, Beardo, was launched in 15-16.
Yeah. In my eyes, it's a bit of a trend. And the way to gauge that is this trend wasn't there in the 2000s or the 90s or the...
Yeah, that's what... it depends completely on the actors. There might be some movies which must be coming A-list actor carrying some beard look and that sets into the practice.
Yeah. My thing with beards is... at least the way I look at it is either you should be like fully clean shaven or you should have a good beard.
Yeah, partial. That's what the patients, the gap, what you said, those patients come for a transplant.
Like they are not confident in the clean shaven look.
Yes.
That's what it is. But the thing is, this clean shaven thing works for some guys.
Yeah, it works. In fact, they might not be only not confident, but they would want to have the other side also. So they want to have the option. Because when you do a beard transplant, you can have both the things. You can carry the clean shaven look also, and you can have a beard look.
This is what's appealing to me. Like that, again, I would be your prime TG in some ways. That I don't have the option to grow a beard.
Yeah, so we can do a transplant and you can have both the things. You can always shave it off. It will grow back when you want it. And that's a normal thing.
But when you've shaved it, it looks like normal
exactly
stubble.
What it is right now.
Any downsides?
Nothing. Done properly, nothing.
Done properly, nothing. Have you seen a little fucked up beard trans? Yeah, like what?
Imagine follicles growing this way.
And? Patchy.
That's amazing. Patchy, different angle, giving a shape or something. Naturally. Yeah.
The way you explained the scalp hair transplant.
Same thing. This also needs angle, direction, density, depth, all those things similar.
Where do you pull out the follicles from?
Majorly single-rooted follicles from the nape of neck to match with the thing, because nape of neck will have single-rooted follicles. Other units, as I mentioned, 2 and 3. So we try to find out maximum single follicles and implant only single follicles. On beard, majorly you'll see single follicles.
Nape is this part?
Yeah, lower part of the neck.
Because it's extremely thick.
It's not extremely thick. It is fine, and more single roots are there over there.
It's easier for you to extract it.
No, easier. It's okay, but it's just the follicles are single in unit. So as I mentioned, there are follicles which may have 2 and 3. So you don't see beard having 2 and 3 follicles coming from a single thing.
I'd not even heard of beard transplants before this conversation. I'd not even planned it for this. I thought
I'll share some pictures with you.
I thought it's only like balding bros watching this, but now it's Chikna bros also. Like gripped on this podcast. I'm seriously considering this, man.
For sure. I'll give you a detailed consultation to...
I'm scared of the pain though, honestly.
Pain is not there. Trust me. Mild swelling for a day or two, that too the anesthesia liquid which is given as a tumescin, nothing more.
And I'll be able to go back to...
Everything normal. Appearance for a beard transplant, appearance would be a concern for 7 to 8 days.
That's it.
That's it. Black dots would be visible wherever you implant because there's small blood clots available seen on the face for 7 to 8 days. That's it.
And what is the care and all?
Just avoid friction on the areas of transplant, be it hair or be it beard, nothing else. Friction in the sense nothing should get rubbed against it because follicles are still naive. You don't need to rub and disturb them. The angles and the maybe come out.
Can you work out and everything?
Heavy weight, avoid for 7 days. Cardio activities can be done. Sweating is okay. You can just dab the area, not rub it. That's it.
And these are the same precautions for the head, hair transplant?
Same.
Biologically, what's happening? Like, why are these precautions even there?
Precautions are not there. In fact, I just said the precautions only you shouldn't be rubbed against the implanted area because you may just pull out the follicle again. That's the only thing. Otherwise, if done properly, again, no slit technique. We are implanting the follicles one by one, so there's no open wound, so there are no chances of any kind of infection. In fact, scalp and face is the very most vascular part of your body, so the chances of infection reduces on its own to a lot.
It heals faster.
What
if someone slaps you hard?
With a beard transplant?
Yeah, after beard.
I don't think so anyone will dare to because that looks more gruesome.
It looks gruesome already.
Yeah, because it's like if you have all blood clots on your face, no one would even dare to do that. They'll in fact pity you for that.
Damn. But you're not truly in much pain.
Not at all.
Okay.
On a scale of 10, I'll say not even 2 or 3.
This is the first time in my life of 31 years that I've heard of beard transplants. Just saying. Like, I think you're actually going to get a lot of inquiries about this also, rather than just the head hair. Moving on. Because actually the conversation is about your scalp. Doc, so the patients who you meet and you think that, okay, you don't need much of a transplant. You need a slightly lighter treatment. That is a possibility?
Yes. Different multiple options are available. So again, you'll see a lot of products being marketed, a lot of gummies, a lot of anti-hair fall shampoos, oils, and different products marketed in different way. So I'll tell you everything like advancement of technologies. We have PRPs, that is platelet-rich plasma, where we take your own blood, separate some growth factors, re-injected. There are mesotherapies, meso solutions. Then there are laser helmets available. All these therapies are available to take care of your hair fall in early stages, to control, to delay the process. There are medicines available as I discussed. Then all these gummies have a lot of vitamins, minerals, which will improve your hair health, but it will not help you in restoring. So yeah, to improve your hair health, you have good hair, you just started facing something, you can try multiple options after getting evaluated by a doctor. But using excessive anti-hair fall shampoos or oil may end up accelerating the process of hair loss. So getting a proper advice is more important rather than just reading on internet, starting on your own.
Let's break down this chapter a little bit, starting with the biology of it.
Yeah.
Taking that tree and roots angle that we took.
Yeah.
So in a case that requires an actual hair transplant, the tree has probably almost become like completely weak and the roots are also weak.
Yeah.
But here you're saying that the tree has not become fully weak and the roots have also not become fully weak.
Yeah.
So adding some factors to that tree and the roots, you'll be able to thicken out hair once again.
So I'll be able to thicken out. More than that, I'll be able to control and delay the process of further deterioration. So my intention is like there are medicines, as we discussed about finasteride, which will block conversion and formation of DHT itself, the major culprit which is causing. But at what risk? So I'm not only finasteride, but other medicine, like other safer options like PRPs, mesotherapies, they are not at least damaging anything. They are your own body, your own growth factors. You can always try. Have certain studies which may help in sustaining your hair for a longer period. At the same time, vitamins, minerals in the form of gummies, tablets are available. Get yourself evaluated. There can be very commonly seen as low vitamin B12 deficiencies, vitamin D deficiencies, which is very common nowadays, which I've seen very frequently. Maybe thyroid or hormonal changes. So all these things can be evaluated and corrected so that the accelerated process is at least in control. And not to use cosmetics, hairsprays, gels, styling, coloring, blow drying, all these add to the damages what is happening. So we can control that. Having a proper guidance is more important.
Okay. I do believe styling products are now very much part of at least urban culture. I have to use them also for shoots. Is my hair not... So here's how I look at styling. I take a lot of pre-care and post-care of it. At the same time, I know genetics are on my side.
Yes.
Personally, a particular hair oil I use called Mahabringraj works like magic for me. And it's been like that for years. But again, that's just my subjective case. What about the guys who are prone to hair loss through genetics as well as are not taking great care of their.
So hair oils, as you mentioned, see, oil doesn't, as per our medical science, that will not benefit you in any ways. It is just, if you don't wash it regularly and if you use your hair oil and keep it for a longer period, you may attract more dust and everything and more eventually damage more. In fact, the head massages what we have may externally damage the follicles. So if someone is used to it as a moisturizing, you can use an hair oil, couple of hours, wash it off. That's completely fine. But not be dependent that some hair oil will help you in saving your hair or getting you new growth.
So the bottom line about hair oil is it works well for some people and may not work well for everyone.
No, it will not work in sense of getting your hair back or saving your hair. It is just working as a moisturizing and additional thing what you want. But that's it. There's no necessity for any individual to have hair oil because your every follicle has a gland to secrete the sebum and get you the natural oil what is required.
Okay. Because we're talking about men who are not genetically prone to hair loss in this case. When we were speaking about at the start of the podcast, we mentioned lifestyle factors, basically like stress or drinking and or smoking and or diet. If you fix this diet factor, if you stop smoking, if you reduce alcohol intake, it will make a difference to your hair health.
100%. Yeah,
Right?
yeah. See, all these are cumulative factors which finally end up in damaging your body. Be it alcohol, be it smoking. End of the day, you are damaging your body. And skin and hair is reflection of your internal body only. So if you have internally very healthy body, it will surely, the diet, this discontinuing drinking, smoking will benefit your hair. The quality for sure.
I've always wondered how Shah Rukh Khan has that beautiful hair despite smoking.
Genetics.
Right? Afghan genetics. Pashtun.
Yes.
Like those guys, another great Pashtun look is Naseem Shah, the Pakistani bowler.
Yeah.
Have you ever played a cricket video game?
Yeah.
So, we used to create players on that.
Yes,
My created player would look like Naseem Shah. Such a good looking guy. Just Pashtun genetics are some next level. There's a stereotype on social media. I don't completely agree with it, but I would like to agree with it because I'm Punjabi. They say that Punjabis look great and all. That's the
100%,
traditional.
100%. They do.
I actually think Pashtuns are even better. They're more.
Everyone has a different perspective. Yeah, all individuals look good in their skin and confidence.
Beauty lies in the eyes of the beholder. But unfortunately,
Beer or B?
in our country, I mean, there are some standard gauges of beauty. But again, Shah Rukh Khan's head of hair, coming back to the topic, that's probably the most beautiful hair I've seen in my life on any man. And at that age, to have that quality of hair, I don't know what's happening there.
A lot of people.
You see this a lot. He's smoking regularly. May not even be sleeping well and all, but for some reason, hair is out.
Random, very rare, but yeah, they are there. But I'll strongly say, if you are smoking and if you can quit smoking just because of your hair, do it immediately.
Yeah, I mean, I've spoken to enough doctors now to know how detrimental smoking can be for every
single
organ,
part of your body, every single cell of your body.
Every single cell. Still people do it. And the thing is, I've been in engineering college where everyone has smoked at one point. Okay, I've had a puff of a cigarette, and the thing is, when you first smoke a cigarette, you become very numb. The first time that you ever take cigarette smoke in. The second time you do it, maybe that'll happen. The third time it reduces, and then it just becomes a time pass thing. And then you catch the habit.
Whenever you have free time, you go out and smoke. That's a habit.
For me, that first time was enough. I was like, dude, I don't want to do this because fortunately, all these narratives about smoking being bad affected me. So I didn't pick up the habit of smoking.
It's lucky enough because it's very difficult to discontinue people who already smoke. So it requires a high level of motivation.
I honestly get the need for people to drink alcohol. I get the need for people even to smoke pot. Okay, because it creates an intoxication. With smoking, for that 10-second numbing, which eventually even goes away through the habit of smoking, are you willing to risk your skin, your hair, all these other things?
More important in every organ of your body.
I've never understood
sometimes
this.
It's a style statement carried away by some people, and sometimes it's a habit which is difficult to withdraw. Sometimes it's a nicotine kick.
Also vapes now. That's the new Gen Z thing. Like, it's not as much.
No, it's luckily it's not legal in India, I believe.
Who gives a
So it's not that easily available. Otherwise, yeah, that's the thing.
I mean, now, sir, like...
there's still studies. I don't know how bad it is compared to smoke, but yeah, equally must be something.
I mean, I think what's worse about vapes is you don't even know what's in it.
And the accessibility, you can vape anywhere, anytime.
Yeah. Because it actually smells nice for everyone around you, but for your lungs, it's like your lungs are dying and crying. And I think even people who use vapes a lot know this on some level, that this is
it's a habit.
it's nicotine, right?
It's
Basically.
nicotine, yeah.
Technically, biologically speaking, what does nicotine do to your body?
Nicotine can damage a lot of things, but at the same time, nicotine creates a habit where you're used to it, you're obliged to it, you want to do it frequently. That's the reason people people who want to quit smoking or vape, they have those nicotine patches or nicotine tablets just to use as a substitute.
Yeah. With your patients who come up to you with again male pattern balding and all, over your experience of being a dermat, you've seen that smoking has a direct relation with.
So, see, smoking is something people who come to me must be of not just recently started, they must be doing it for many years or so. And just stopping it for that duration during a transplant is not going to make much of a difference. Though people say and theories say that before going for a transplant, you have to quit smoking and you don't have to continue for 14 days. If that helps helps them in quitting the smoke, I will also give the same knowledge. But practically, it is not that related for a short term because smoking is damaging your cells and eventually it will damage a lot of things.
Is smoking directly linked to hair loss? It is.
It will aggravate.
Right? Because basically it's the death of your cells.
Yeah. So it will, in many ways, it will damage your hair.
Okay. What other lifestyle factors do you think as a MD dermatologist are linked to a reduction in hair quality?
Everything's majorly stress because that will damage and change the entire hormonal balance. Inadequate sleep, improper lifestyles like unhealthy dietary habits, sleeping habits, not exercising, your lifestyle changes, then the water pollution, the environmental conditions, every single thing plays a role. So yeah, it's a multifactorial thing which accumulates and causes this thinning and fall.
Kind of brutal input and brutal question, but when you're saying environmental factors, the air quality, the worst case is urban metros in India, right?
Yes, a lot of pollution is there, which everyone of us can feel. Plus, then there are certain cities and regions where the water quality with high mineral content, high chlorine content, I'll not say a major cause, scientifically proven, but yeah, this will add to the damages.
I think this is that whole hard water, soft water thing, right? Like people, so this is what happens sometimes when you travel to a smaller city in India. If you're trying to shampoo your hair, you notice that the shampoo doesn't wash off properly. That's a sign of hard water.
Majorly, yes.
And
high mineral content or high chlorine content water.
They say that hard water can damage hair quality.
It can accelerate the damages happening. May not directly, but yeah, can accelerate it. Can add to the disadvantages.
What about people who live there? They have to just live with it.
Softener can be used. There are hair softeners you can attach to the shower cap or something. This may reduce it. As it's not the primary cause, it's just aggravating it. So yeah.
Okay. And as a doctor, when someone comes to you and you don't have to give them a hair transplant, you spoke about all those different treatments. All those treatments are from the perspective of helping hair nourishment and making that tree grow back, right? Do you think it's important to talk about that right now? All those treatments, or it's very subjective per?
It's completely subjective. We need to understand what stage they are, what benefits they can get, and we have to give a very transparent opinion. Just not for the sake of a patient has come. Supposedly you come to me that I need something, I'll say don't take care, don't do anything. Don't make yourself adapt to this environment where you start taking additional care and then you become dependent on that. So a proper evaluation, a doctor consultation is very important before you start anything. That's what I'll say.
Doc, we've almost reached the end of the episode. I've figured that whenever one is doing medical podcasts, one should also always talk about the bullshit going on in the world adjacent to medicine. Like, I think because we're talking about a human insecurity in this whole conversation, people can get fooled a lot. See banaya jata hai. All this happens, right? Let's talk about some of those so-called scams or stuff that's going wrong in the market. Like what mistakes is the average consumer doing in order to just save the hair?
So there are a lot of marketing gimmicks. A lot of people take celebrities as their brand endorsements, for their brand endorsements, get products where they tell you to use a product for a year or two and get your hair back. They'll show you some images, and people get attracted to that because it's a cheap option. No one would think twice spending a couple of thousand or maybe 5 to 6 grand behind these products. Maybe try for a year, get disheartened, and discontinue. Those agencies or those companies who are making such products, they are just targeting this. India is a huge population, 1.4 billion population. They just want it to reach once to these patients, and they'll make enough money and go out.
Like even if they capture a small segment of that
100%.
population, they'll make money.
And because of social media, the reach is there. Everyone would want to try. Why not trying something for 2,000, 5,000, maybe for a year? What God knows if it comes back. That is what the entire mentality is. And then it's promoted, endorsed by a good amount of celebrities also. So people trust them. So that is something which shouldn't be happening. But yeah, it's very common. I don't know till when.
Okay. And finally, I think it's important to also talk about medical tourism in India. We spoke about Turkey briefly.
Yes.
You said that the Turkish industry is actually way ahead of the Indian industry.
In terms of medical tourism in hair transplant, for sure, because of the government aid and support and accessibility and affordability and all those things. But if you ask me, I considered, in fact, my vision would be to contribute India to establish as an epicenter for cosmetic, aesthetic, and hair transplant procedures. Trust me, Indian doctors are trusted across the globe for their passion, for their trustworthiness, for their experience and skills, where no one can experience that. In fact, I'll tell you a small story. I had a recent patient from the USA who traveled for a transplant, who's himself is a practicing cardiac surgeon for more than 20 years. So I happened to ask him, so what made you travel all the way, where you must be having a lot of colleagues doing transplant in the USA? So he's like, I was crystal clear in my mind. Whenever I want to do a procedure, I would prefer an Indian doctor because of their dedication, passion, experience, and everything. So this testimony itself gave me that confidence that Indian doctors are looked with very high caliber globally, and we are here to set high standards for healthcare, for hair restoration, and ethical practice. That is what we want to. In fact, medical tourism, not internationally only. In fact, in India also, in my early days of my setup, a lot of patients used to travel to the clinic from 2-tier, 3-tier cities searching for good transplant procedures. That made us establish across in many centers, and I intend to have centers across each and every corner to give the best transplant procedure with ethical practice. That's the intention. In fact, I want Assure to be known as a synonym of hair, and pura desh bole baal achhe.
All the best with the mission, doctor. This was very enlightening from multiple perspectives. Any signing off notes that you have for patients? Because bros have watched this with a lot of insecurity, and even a few of those women who are dealing with those balding issues. Everyone's seen this from a tension perspective. Would you like to say anything about that tension?
So, first, only thing I'll say is always whatever you want to do, consult a doctor. In fact, we have a different approach. In fact, I have a different approach is whenever there's a patient entering Assure, they always see the positive vibes, the purity, what they feel. And I believe this is purely a reflection of Dr. Priyanka, my wife, where she believes that every patient needs to be put ahead of everyone. We have to raise our standards to a level where everyone we can do better every day in each thing what we are doing, and give the highest standard procedures what we want to do. So that is what the intention is. Trust the doctors. I would have a message for the doctors also. Invest your time in the procedure. Do lesser number of procedures. Charge more. That's not a problem. People are ready to pay. But do the procedures yourself. You'll see the difference and the patient satisfaction.
Okay. That's all for today, Doc. You had fun?
Thanks so much. Perfectly.
Okay. The message is out there
Yes.
for people who are dealing with this trouble.
Yeah.
Okay, awesome. It was great having you on the show, Doc.
Thank you so much.
Great being educated, and I'm sure this podcast is going to help lots of people out there.
100%.
Thank you, Doc. So, ladies and gentlemen, that was the episode for today. When I create episodes like this, which are a bit of a throwback to the beer biceps fashion and grooming days, my intention first and foremost is to help younger and older men handle their own insecurities better. As I have said repeatedly over the course of this episode, this is a very solvable problem. So please, gents and ladies, relax if you're dealing with hair fall. Relax if you're dealing with a receding hairline. But learn to educate yourself enough about this particular topic. Dr. Abhishek Pilani will return on the show if you wish so. Please tell me what you thought of this particular episode in the comment section below. Tell me if you have any other doubts related to hair transplants. Drop them in the comments below. And the only signing off note I will leave you with is, if you're dealing with any kind of medical or genetic issue, first and foremost, turn to the MBBS qualified and MD qualified professionals. Turn to doctors for help, and don't try cutting costs. Don't try saving money when it comes to any kind of body modification. Please have a safety angle with whatever you're doing, first and foremost. And secondly, please remember to relax. Life is short. Enjoy life. It's 2024 and science has all the answers. Lots of love to all of you. TRS will be back with many more epic episodes just like this very soon.